Good afternoon, hopefuls. It is Wednesday. I figured that out after the last post. I do try to check in on Wednesdays. I missed last Wednesday just because things weren't going very well, and I was really tired and feeling sick due to medication. But I wanted to come back here and kind of give an update on what's been going on. Beyond that, you can hear my dog. She's gagging on something. I don't know what it is. Furball. Anyway, she's fine. Don't worry, she's fine. She's just over there making weird noises. Anyway, so about 2 or 3 weeks ago, I started having a really high increase in anxiety, and it's probably been longer than that, but that's what I can. She did it again. I'm sorry. So that's what I can remember. I think it may be longer than that, but anyway, so my anxiety started increasing. I doubled my medication. I started to feel better. And then right about that time, I started going on medication for an antidepressant. And that just really threw me for a loop in a sense that it just I did not handle it well. And so the doctor has decreased it because I had a follow-up after she prescribed it. And she decreased it, and since then, I have felt better. I didn't have much of an appetite with it, and I was really not interested in just eating in general because my stomach was upset. But that since has subsided, and I've gotten my appetite back, and I feel like I can eat. But my anxiety is still really high, and so I just. My anxiety is so bad that I haven't left the house in a really long time. And I was supposed to have a doctor's appointment tomorrow for a psychiatrist for an initial appointment for just mainly medication. Make sure that I'm on the right track with what I've been what I've been prescribed, and even with what I've been diagnosed. I have not gotten that professional diagnosis except for coming from a primary care doctor. But a few weeks ago, when I went to the initial doctor's appointment about the medication, because I was requesting an up in my anxiety medication, she ended up prescribing me the antidepressant. And she, based on the things that I was telling her during that appointment, she thought that she thinks I have agoraphobia. And just the little research that I've done, I can tell that I believe it to be true, and I do not want to leave my house. I had an appointment, like I said, tomorrow that I was supposed to go to, which I canceled because they will not do the first appointment on telehealth, and I have no desire or will to leave the house despite knowing how important this appointment is. And I had an appointment, I think it was last week. I've been pushing my appointments out for like the last few weeks, just various health appointments, nothing mental health wise, just because I just don't want to leave the house, and I feel like I can't leave the house right now. It causes all kinds of anxiety. I think about it for several days prior to it, and it's just really tough for me to leave the house right now. And a good example is my neighbors are literally right across the sidewalk. And if you recall, my car got broken into a couple weeks ago, and they tried to steal it. And this is the second time this has happened since I've lived here. And my neighbors feel sorry for me, and they brought me a little sweet treat to apologize for this happening and just kind of letting me know that they care. And so I appreciated that gesture. That was really sweet. And they're literally right across the sidewalk. And I have their dish, because they provided an entire dish, and I have their dish. And I don't even want to go give it to them. I'm going to have to figure out a way to get it back to them. And I have to plug my phone in because it's going to die here in a second. So that just shows that it's really hard for me to get out of the house right now. And, I was trying to think of a topic for the forecast. I was trying to think of a topic for this Sunday with respect to the podcast, and I think I'm going to do something about, because this is what I am going through right now, is the fight or flight, freeze, or fawn, because right now I feel like I'm very much in a freeze mode, and I'd just like to learn more about it. I think it would be real interesting to understand if there are multiple types of freeze, or just things like that in general. So that's what the podcast is going to be about on Sunday. And so look forward to that coming out Sunday, or sometime Sunday. But anyway, that's just kind of a quick overview with respect to what's been going on in the last few weeks, and especially why I was kind of out last week, because I was dealing with the new medication. So anyway, I hope you all are having a wonderful Wednesday, and I will see you Sunday. Bye.